Thank you. I'm audible now. Yeah.
Absolutely.
Aditya is giving us
Yeah.
5 minutes, no?
Yeah. Okay. So nowadays, whatever happens, we think it is due to COVID because whatever we don't know, we think it is due to COVID. I will show you one case, for example, like that. 23-year-old female presented with floaters and scotoma, sudden onset since 1 month. She had hearing problem, was using hearing aids from childhood. History of COVID 1 month back, and after that she got mild COVID, and after that she got these symptoms of some scotomas, patchy scotomas and floaters. So this was the picture. When I thought there is something in the disc, a little hyperemic, mild pigment changes in the periphery. So we did an extensive workup. OCT did not show any hyperreflective dots or anything like that. Reasonably fine. No edema. RNFL was normal. ERG we did a mild reduction in the photopic and scotopic, more in the photopic than scotopic. Visual field we did peripheral inconclusive peripheral field effects, something like clover leaf probably. Then this is a fundus picture. If you see, the periphery is having something like pigment clumps and all in the periphery. Probably early bone corpuscle sort of thing. We don't know. Then this was the angiogram. You can see that there is leakage from the peripheral blood vessels in the all these vessels are leaking. Small vessels, microangiopathy. In the right eye also, this is early. This is a little later phase, and the periphery some non-perfusion is there. But no disc. Disc is not at all hot in the all the phases. So some investigations were done. Mantu was all these investigations came negative. We had a suspicion of vasculitis, so I sent them to a person who is expert in COVID. So I thought it is microangiopathy secondary to COVID. So he started on oral steroids. I started on NSAID drops, and he gave deflazacort, mycophenolate mofetil, all this stuff, and absolutely no change. In fact, after 1.5 months, there was absolutely no change. Repeat OCT was same, and even the fundus fluorescein angiography did not show any change. Disc is not hot. The peripheral leakage is similar. So vision was 6/6, floaters same. So I told him that nothing is happening. So maybe may not be related to COVID. So my fellows found that there is a connection between the hearing loss and probably this thing. So they thought maybe this is retinitis pigmentosa, Usher syndrome or Susac syndrome. So I had and it is not related to COVID. Because I don't know, because I have not seen this. I referred the books, and they said that in Susac syndrome and all, you get retinal artery occlusions, branch artery occlusions. So this was the case.
I don't think
Ultimately, we
this
decided, ultimately we thought it is not due to COVID.